Hi, my name is Amrit. I'm going to be your nurse today. Can I just get your first and last name and date of birth?
Sure, it's Madeline Keeley and 7198.
Okay, perfect. And then today we're going to be just performing a head-to-toe assessment on you. Is that okay with you?
Mm-hmm.
Okay, and then before we get started, I'm just going to be grabbing a height and weight. And then I'm just going to have you turn around and I'm just going to check the curvature of your back. I'll have you bend over. So your spinal cord is intact. There's no abnormalities. And then I'll be just checking for any kidney infection. So I'm going to take the back of my hand and place it on your back and then tap. And then just let me know if you feel any pain.
Okay. No.
Okay, perfect. So there was no signs of kidney infection. So when the patient walked in, her gait was normal. There was no abnormalities in her posture. And then I'll just have you have a seat for me. Okay, so looking at the patient's appearance, they're dressed and well groomed for the weather. There's no abnormalities in that. So I'm just going to be assessing your short and long-term memory. So I'm going to be just giving you an address and then I'm going to have you repeat it back to me later.
Okay.
So the address is 123 Ferris Street. Got it?
Yep.
Okay, and then for long-term memory, where were you born?
Petoskey.
Okay, and then so the patient's long-term and short-term memory seems to be intact. There seems to be no abnormalities, and then I'll be assessing your mental status. And then can you tell me what time it is, like roughly?
12:30, 1 o'clock.
Okay, and then do you know where we are?
Ferris.
Okay, so patient seems to be alert and oriented ×4 to time, place, and purpose. And then can you repeat that address back to me?
123 Ferris Street.
Okay, and before we get started with your vital signs, I'm just going to do a pain assessment on you. Can you tell me if you have any pain today?
Yeah, I'm having some pain in my shoulder.
Okay, and then when did this pain exactly start?
Probably a couple days ago.
Okay, and then can you describe me your pain?
It's kind of dull and aching.
Okay, and then have you been doing anything that helps with your pain?
I've taken some Tylenol and I've also done a warm compress.
Is there anything that's making the pain worse?
Just when I have to lift it like above right here.
Okay, and then before we get started, would you like anything for your pain today?
No, I just took some Tylenol. before I
Okay,
came.
perfect. And now I'll just start with your blood pressure. Slip your And then you can place your hand on my lap if you would like. Okay, good. Your blood pressure was within normal ranges. It was 124/74. And I'll just be grabbing your pulse. Okay, so your pulse was within normal ranges as well. So your pulse was 70 and then your respirations were 14. And then just observing your hair, you're well groomed and dressed for the weather, which is good. Okay, so now I'm just gonna be checking your skin. So we're first just gonna start with your hair and your scalp. So I'll have you bend your head over towards me a little bit. So looking at your scalp, there seems to be no abnormalities nor no lesions, and your scalp seems to be symmetrical to the rest of your head. And then looking at your hair, it seems to be well distributed, it's well groomed, and then there's no signs of hair loss, which is good. And then looking at your eyebrows, they seem to be well distributed as well, clean and then intact. And then I'm just going to be moving on to your skin, so I'll have you roll up your sleeves for me. And then looking at your skin, it seems to be intact, no signs of lesions, scarring, any sores. And then to touch, it is warm, which is good. And then looking at your forehead, seems to be good too. And then now moving on to your nails, so your nails seems to be well groomed and clean. And then checking for capillary refill. Capillary refill seems to be less than 2 seconds, which is within normal ranges. And now I'm just going to be checking your legs, so I'll have you roll up your pants for me. Looking at your legs, there's no signs of edema, and then your skin on your legs seems to be intact, no signs of lesions, scarring, any bruises. So now I'm just gonna be moving on to your head and neck. So first, just looking at your head, there seems to be no involuntary movements, no signs of abnormalities. It seems to be intact and symmetrical to the rest of your body. And then moving on to your neck, there seems to be no lesions, no scars. So everything seems to be normal there as well. And now I'm just gonna have you tilt your head back for me. And I'm just be checking your thyroid and to see if there's any tenderness or pain or any enlargement, and then I'll have you swallow. Okay, good. Any pain or any tenderness? Okay, good. And now I'm just going to be checking your overall lymph nodes, your clavicle and subclavicle as well, and then just let me know if there's any tenderness or pain in that too. So I'm going to be starting behind your ears, going down to your clavicle. Any pain or tenderness? Okay, good. So everything seems to be good, no abnormalities, and now I'm just going to be checking for cranial nerve number 7, which is just facial movements. So I'll just have you smile for me, and then frown. Have you close your eyes. Can you lift up your eyebrows, and then puff your cheeks? Okay, that seems to be good. And then I'm going to be checking for cranial nerve number 5, which is your trigeminal sensory movement. So I'll be taking a cotton ball and then running it on the side of your face, and to just let me know if you feel that sensation. Okay, I'll have you close your eyes.
Yep.
This side.
Yep.
Perfect. So that seems to be intact as well. Okay, so now I'm just going to be moving on to your eyes. So your eyes seem symmetrical to the rest of your face. There seems to be no abnormalities, and now I'll have you close your eyelids for me. Okay, so your eyelids seem to be intact. There seems to be no lesions, no scarring. And then looking at your eyelashes are well distributed. They're clean, they're intact, which is good. So I'll have you open your eyes again. And now I'm just going to have you pull down your eyes to check your conjunctiva. So your conjunctiva is pink and moist, no discharge coming out, no fluids, any abnormalities there. And then looking at your cornea is clear, so that everything seems to be normal. And then your sclera is white, so there's no abnormalities there. And now I'm just going to be checking for cranial nerve number 3, 4, and 6. So first I'm just going to be checking for pupillary response. So I'm going to take my pen light and flash it through your eyes, and then to see if your pupils accommodate to light. Again. Okay, good. So your pupils accommodated to the light, your pupils responded, and then everything seems to be normal. And now I'm going to have you look at me, and then look back at the clock, and then look at me again, okay? So you're looking at me, and then back at the clock, and then me again. Good. So your pupils responded to that as well. And now I'm just going to be flashing the light one more time, but in one eye, to see if that reflex in your other eye accommodates to dilate again. Okay. Good, so both of your pupils at that point dilated, which was good and normal. And now I'm going to be checking for your extraocular movement. So I'll take my pen light and move it, and you'll follow it with your eyes, okay? Good, so your extraocular movements were intact. There was no signs of abnormalities there. Okay, so now moving on to your ears, I'm just going to be inspecting them first. So they're both symmetrical to the rest of your body, and there seems to be no abnormalities. And I'm just going to be palpating for your mastoid process and then your tragus. So just let me know if there's any tenderness or pain, okay? Any pain or tenderness? Okay, good. And now we're just going to be performing a whisper test. So I'm going to go behind you, and then I'll have you cover one ear up, and I'll whisper something in the other ear, and then you're going to repeat it back to me, okay? Hamburger.
Cheese.
Okay. So the whisper test was good. There was no signs of any hearing loss or anything like that. Just moving on to your nose, I'm just going to be inspecting it first. So it seems to be no abnormalities. It seems to be symmetrical to the rest of your face. And now I'll just have you tilt your head back for me, and I'm going to just flash a pen light in your nose to check your septum and then your mucosa. So your septum seems to be intact, so there was no abnormalities, and your mucosa was pink, which was normal. And now I'm just going to be checking for your frontal and maxillary sinuses, so just let me know if there's any pain or tenderness, okay? Any pain or tenderness?
No.
Okay, good. And now I'm just going to be performing a patency test, so I'll have you hold one of your nostrils with your finger and then breathe in through the other nostril. And then was there any trouble breathing or any difficulties in that? Okay, good. Okay, so now I'm just going to be inspecting your mouth. So looking at your mouth overall, it seems symmetrical to the rest of your face. There seems to be no abnormalities. Your lips seem to be pink and moist, which is good. And now I'm just going to be having you smile. So your teeth are all intact. There seems to be no abnormalities there. Your gingiva is pink and moist, which is good. And now I'm just going to be testing for cranial nerve number 10. So I'm going to have you open your mouth and I'm going to flash my pen light in there just for checking for your hard and soft palate and your uvula and your pharynx. Okay. And then have you say ah. Okay, good. So everything seemed to be intact and normal there as well. And then cranial nerve number 9 is the gag reflex, which I won't be performing. So now moving on to cranial nerve number 12, which is going to be just checking for your tongue, and I'm going to take the tongue depressor and then looking at your tonsils as well. Good. On the other side. Good. So your tongue seems to be good, no abnormalities, and your tonsils were intact. So now just moving on to pulmonary. I already got your respirations, which were within normal ranges like we discussed earlier, and I already checked your clavicle and subclavicle lymph nodes. So all I have left is to listen to your lung sounds. So I'm just going to have you breathe normally for me. I'm going to check the front and then the back. Good, so your lung sounds were normal. There was no signs of crackles or wheezels. So now I'm going to be moving on to cardiovascular, so I'm just going to take a listen to your heart while you're sitting. So listening to your heart sounds, everything seemed normal. Your S1 and S2 were beating strong, and there was no abnormalities, and there was no signs of any murmurs or anything like that. So now for the next part, I'm just going to have you take off your shoes and socks and then lay down.
Okay.
So now I'm just going to take a listen to your heart again while you're sitting, and then after I'm going to just take a listen to your apical and radial pulse at the same time to see if they're beating at the same rhythm.
Okay.
I'm just going to be checking your apical and then your radial. So again, there was no abnormalities, no murmurs, no S1 and S2 were beating strong as well, and then your apical and radial pulse were beating at the same time too, which is good. So now I'm just going to have you tilt your head to a 30 to 45 degree angle. And now I'm just checking for jugular vein distension, so there's no signs of that, so which is good. And then while I was looking at your extremities and your face, there's no signs of edema, which is healthy. And I'm just going to be looking for a pedal pulse and then checking for capillary refill. So your capillary refill was less than 2 seconds, which is good, and then your pedal pulses were really strong as well. Okay, so now we're just gonna be moving on to the abdomen part of the head to toe assessment. So I'll just have you lift up your scrub top for me. Okay, so now just me inspecting your abdomen. There's no signs of scarring, no signs of abnormalities or any contour looks good. That's good. And now I'm just gonna be auscultating. So I'm gonna listen for any abnormal vowel sounds. So there was no abnormal vowel sound, so that's good. And then I'm just gonna be palpating, so just let me know if there's any tenderness or pain while I'm doing this. Any pain or tenderness?
No.
And then in a normal head to toe, I'll just be looking for inguinal lymph nodes, which we're not gonna be doing today. You can pull down this group. Okay, so now we're just going to be moving on to the musculoskeletal portion of this head to toe exam. So I'm just going to be checking for your joints first. Good. So those seem to be intact and no abnormalities there. So we're just going to do some range of motion with the wrist first. So I'm going to just have you twist your wrist for me. And then back. Yep, good. And then some range of motion with your arm. So you're just going to follow me. So we're just going to go up and back and then to the side. And then back again. And then I'm going to have you just do those again with your other arm. Good. Was there any abnormalities there?
No.
Okay. So now I'm just going to be checking for your spatial sensory function. So I'm going to just have you take your arm, go like this. And then I'm going to have you close your eyes for me. And then I'm going to just hand you an object and then you're going to repeat it back to me.
Pen light.
Good. And then just going to draw a letter on your hand, and then you're going to repeat that back to me too.
X.
Good. So those seem to be intact as well. And now I'm just going to be moving on to your lower extremity. So I'm going to have you push up against. And I'm going to do the Babinski reflex on your feet. So that was good, and then the last part is just your range of motion with your legs. So I'm gonna go. Good, and now we're just gonna do the other side as well. And then back to your feet, I'm just gonna have you twist your ankles for me. And push down. And push. Good, so everything seemed to be within normal ranges. There was no difficulty for you to perform those range of motions, correct?
Mm-hmm.
Okay, good. Okay, so now I'm gonna just have you sit up for the last portion of the musculoskeletal. Okay, so we're gonna first start off with some range of motions of the neck, so I'll have you just follow me. So to the side, other side, back, and then front. And then for cranial nerve number 11, I'll just have you push up your shoulders here with me. Yep. And then your face, other side, head, and then back. And was there any difficulties doing that? Okay, good. And now we're just gonna end with the deep tendon reflex. Good. So that seems to be intact as well.
That completes our head to toe assessment. We hope this helps you be successful with yours.
Thank you for watching.